Hello and welcome to another episode of the Decolonizing Global Health podcast, a product of the African Population and Health Research Center. Today is a very big day for us. We are celebrating the Day of the African Child, and to do that, and rather to help us do the celebrations, we are joined by one of APHRC's foremost thought leaders on early childhood and development. I will not preempt too much. I'll just hand over to her and let her introduce herself. Over to you, Daktari.
Thank you. My name is Dr. Margaret Nampija. I am a medical doctor like here and an ECD or Early Childhood Development Research. I'm currently working in the African Population and Health Research Center as a research scientist focusing on ECD research within the ECD unit, which is also hosted within the Human Development Unit. I lead the focus area on integration of health of ECD into the mainstream health system.
So tell us a bit about how APHRC is contributing to the general health and well-being of children, especially those under 5.
Yes. Within APHRC, we are like you, whoever has read about APHRC, our focus is generating evidence. It's also working with the evidence to transform or to influence policy. But also we support initiatives, and now I specifically focusing on ECD. So we have a fully fledged ECD unit within which we conduct or we lead a lot of research to generate evidence that will inform policy and practices or service delivery within ECD. So we undertake, our work is organized in 3 focus areas. That is childcare patterns, in which we ensure that we promote quality childcare services that meet all the standards of nurturing care. And then we have integration of ECD within the mainstream health systems, where we promote and advocate and we generate evidence to inform full integration of ECD in its right into the health and other systems, including education. And we also have the third focus area, which is early care and education, where we focus on promoting early learning for early learners within the education system. But also this includes work on disabilities, because often times these are left out. Within the 3 focus areas, we have actually conducted a lot of studies in Nairobi, in Nakuru, in Kajiado and other counties within Kenya. And we have worked, for example, within childcare, we have mapped the daycares within the informal settlements. We have also profiled their quality, and this has really revealed so much useful information for policy, for practitioners, for stakeholders supporting childcare. And particularly, I can't stop without speaking about the poor quality of daycare centers in the informal settlements. And we haven't stopped at just generating the evidence. We have worked with communities to come up with initiatives or interventions. For example, the community of practice intervention, where we worked with the government stakeholders, particularly in health and in education, to come up with a model of improving the skills and knowledge of center providers, but using the CHVs or CHPs as they're called these days to build the capacity of the daycare providers in order to improve the environment of daycare centers in the informal settlements. And that has been fully documented, and it's just about to be, scaled up. We have also evaluated different modalities of daycare provision. For example, we work very closely with Kidogo to evaluate the impact of their Kidogo model on improving daycare centers, and how that can be scaled up and how that can be supported by government, because currently I can say more than 90% of the childcare work is being supported by private sector. And beyond generating evidence through empirical research, we are working with the evidence and working very closely with decision makers, especially policy makers, on making sure and fast-tracking policies and regulations speaking to childcare, but also ECD in general. For example, in the past 1 year, we have supported and been involved in development of regulations for Nakuru County, for Kajiado, and as well as for Nairobi. And in the national ECD policy, we were there supporting that process with the evidence that we have so far generated from the work we do in ECD. Even ECD, we have the ECD as the main focus unit for ECD work, but our colleagues in other units also focus on health of children, of young children, together with the other work they do. On the nutrition, we have the food and nutrition unit who focus on nutrition, but also carry along how children feed, how can malnutrition be reduced among children, especially those that are most vulnerable. So we bring together all the 5 areas of natural care framework: the nutrition, the health, the developmental milestones, the care, and the responsive caregiving and safety. We try to bring the holistic child together by generating evidence that will inform practice, service delivery, and policy, the APHRC.
Okay. You've spoken a lot about evidence generation and translating that into policy and practice. Just zeroing in on the care aspect, what are some of the key learnings, if we could stick to top 3 learnings on the effect of care on the outcomes of children, especially sticking to this particular age group of the under 5s?
We all know that the age between 0 to 3 years, or the first 1,000 days, 3 years, it can be extended, 5 years, are critical for children's development. And that means that anything that is denied in terms of care or quality, whether nutrition, whether health, whether stimulation, whether monitoring their development, has real serious implications for their real-time development and well-being, but also can have very grave implications for their later development and success later in life. So we have done a lot of research and in this age group, and what we learn, the key things that stand out, especially in our setting here in Kenya, is so much has been achieved, especially in terms of ensuring that kids don't die, reducing mortality and allowing more children to survive. But a lot more is yet to be done, especially in the areas of nutrition, especially in the areas of optimizing developmental outcomes of these children. So what I mean here is, as I speak, between 25 to 40% of children in Kenya, some within Nairobi, informal settlements, others within areas like Turkana, Kajiado, are not meeting their developmental potential, are developmentally not on track. And it's about the same percentage having malnutrition, stunting. So we found that there is still a big gap in terms of enabling kids thrive in as much as they are surviving. A lot has to be done to ensure that all kids, 100 kids out there, are able to thrive and achieve their developmental outcomes. So, and then the second thing that strikes us out there is we still have a lot of gap in terms of provision of care, right from the household to the community level. And now I just spoken about the child care facilities, daycare or center-based care for children, where everyone out there wants to sort out the problem, the high demand of child care, but you find that the carers are not trained, the daycare centers are not regulated because the regulations or guidelines or policies are not yet there. And everyone is trying to, some of them are making money off it, but it's all to whom it might concern. And so the kids within those environments, within those centers, are not receiving the optimum care. They are eating cold food in some of the daycares, the spaces in which they're being kept are dark and not stimulating. The carers are not educated. They have no idea on ECD. So that's another big gap that has come out, from the work we have done, especially in the informal settlements here in Nairobi and also in Nakuru where we've worked. And the third gap is also related to this, is policies, regulations. So a lot during this time is being catalyzed or accelerated in terms of moving the regulations and policies. And thanks to our work, because when we first started, some of the counties actually had documents on paper, but they had been lying there for the longest time. But working with the different government stakeholders, especially the education, social services, and gender, that has revamped their energy, their enthusiasm to fast-track the regulations. So, but currently now there's still a gap. I mean, you can't point to a policy and say this is a policy on childcare or a finalized regulation on childcare. It's still gray, but there's hope. I mean, maybe within the next 2 years, all these regulations that are out there in the processes will be finalized, and then that they can be implemented to ensure that there is really quality regulation and support to the daycare centers that are currently not in good shape.
So if I hear you correctly, those first few years are very, very critical. But at the same time, we are not doing enough to safeguard our children and that development, those milestones within that time. And also, I mean, thinking about today's day where there's so much demand on our time as parents, and we need childcare. The demand for childcare is very high. That brings in the issue of daycares. They're a general resource, they're a great resource for many communities, especially in the informal settlements. So how can we use or work with these institutions to change the trajectory of the growth and development of children, apart from what you've just said in terms of policy making and coming up with these ideal models of what they should be? What else can we do? How can we partner with daycares to just make sure that children are getting everything that they need?
Yes, I see the best model. I don't want to say ideal because not everything that ideal works. The best model, and from our experience working with daycare centers, is to have a public-private partnership. All stakeholders involved in childcare, whether the providers or the government or the researchers or the other NGOs out there who support daycare centers, but they do it in pockets. So the fragmented way or approach that we are currently taking in supporting childcare is not very effective. So the public-private partnership is very important, where we reach out to each other. I'm a researcher, I'll generate evidence on how many daycares out there they are, for example, in Nairobi, and especially in the informal daycare. And then the daycares will also, are expected to also rise up and join if it's support to come out, because a lot of the time we found that some of the daycares, because of the bad shape in which they are not very willing to come out to be registered, for example, or to join the networks that could be available out there because they fear litigation. So I think we need all work together and provide that support for us as researchers, the evidence, and then the government, the regulation and support, not just litigation, but also supporting in as much as they can in terms of monitoring, in terms of capacity building, but also the daycare centers also to be ready, to be willing to receive this support. I mean, when, for example, for our community of practice project, we have developed a manual and we'll be calling out at scale, we'll be mobilizing these daycare center providers to be trained. But if they're not happy or if they're not willing, if they're still in the hiding, that can be difficult. But importantly, what is missing is that the daycarers do not have the skills do not have the resources, do not know what it is to have a good quality. They need the education, they need the trainings, and some of them need to even improve their structures. Where they host these kids is not really very safe. They should be willing, they should be open to the ideas, the training that define what a quality or standard quality daycare is.
So as we wrap up, what is your dream for Africa's children?
I quite have a lot of dreams, but I can summarize to one end goal. So a lot of the time when you say, like you said, African child to the world out there is already something that is not depicted so positively. My dream is African children are just like any other children out there. In fact, I think we could have a greater potential based on the heritage that we have than other kids out there in the world. So my dream is that we can have all our African children reach their developmental potential. This has been sounded and resounded in so many writings. I think it's possible if we do the right things. We want to see every child receiving the nutrition and growing to the height they're supposed to, their genetics can take them to. We want to see every child surviving, not dying at birth or in the first 5 years or, I don't know, in the first 10 years. Surviving, but also thriving to that individual who will become a doctor, a lawyer, a scientist, a carpenter, if it's carpentry that we want, like to their full potential and be successful in life, because these are children here today, but they are the world of tomorrow. Without them or with them, but really substandard or sub-quality human beings, our heritage, our ancestry, our future as the human race, Africa, will be doomed. We've got to do more locally, in as much as it's a global village. Certain things are specific and unique to context. Here in Kenya, our children and our context could be different from what the rest of the world could be. And within Kenya still, different regions, for example, the arid, very dry areas suffer unique challenges. You can find that water is so hard to come by. I mean, they have their climatic challenges, which may not be the case here in Nairobi. So we need local data. We need to understand ECD in the context where the child is living or residing. So still in the spirit of decolonization, we've got to stop thinking that evidence, practices, initiatives, programs can be generalized to all children. That's not very accurate. We need to tailor anything that is planned for the child, even policies, to speak to where they are at. Yeah, and that's why I like the system here in Kenya. Every county is allowed to come up with its regulations, and that speaks to the fact that they appreciate the uniqueness of the different contexts. Yeah, and our work has actually revealed that there are geographical differences based on what happens to children. For example, when we're looking at childcare, we went to Kajiado, we studied Nairobi informal settlements, and we've been to Nakuru. And what we found that there are similarities, but also very unique differences that are very significant and therefore determine the outcomes of children. In Kajiado, parents, caregivers are still indigenous in the way they are parenting their kids. In Nairobi, it's a lot of urbanization where you do not find the kin or the kinship supporting children or childcare. Everyone, a mom and dad in the family, and if they're not there, then they'll take the child to daycare. So they no longer have grandmother the way it is in Kajiado. And in Nakuru, within the urban setting, it's a bit similar to Nairobi, but it's not exactly the same. And so that also applies to the challenges children go through in the different contexts. In the slums, we talk about poverty, we talk about crime, we talk about child abuse. In Kajiado, maybe it's not child abuse, it's the long distances kids have to walk with their mothers in search for food, for water, or the long distances they have to go for to find a school. So there is similarity, but there's also very unique differences that mean that we need to understand the context of the child in their unique setting. Yes, in terms of gender differences, when they are aged 0 to 3, there are not much differences between girls and boys. All kids need food, a balanced diet. All children need to be healthy, immunized, well, taken to hospital when they are sick, to be protected. All children need to develop the same way. We don't have major gender or sex differences, and therefore in the practices or in the support and care that they receive, that shouldn't really be very distinct. But as they grow, of course, cultural differences come in. But now these days we are trying to reduce disparities, because sometimes when we capitalize on cultural differences, roles, defining roles of boy and girl, some of the disparities in the care, in the privilege, or in access to services has come in because in some communities they feel a girl will after all get married and start bearing children, and the boy therefore should go to school and become an engineer. So we are also looking at those things and trying to remove the disadvantage, especially for the girl child. But again, as we do that, we found that over the past decade, we are focusing a lot on, the world was focusing a lot on emancipating the girl, and what has come through now is that the boy is being left behind. So I think we have to be mindful how we out or downplay the gender and how the girl boy can be fronted, or the balance between the two genders should not really cause a disparity in terms of the outcomes that we are looking at.
All right. Thank you very much, Dr. Nampija. That was the Decolonizing Global Health podcast, the Day of the African Child special.